Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCray.
Recently, researchers at the Mayo Clinic in Arizona decided to find out if eating red meat affects a patient's mortality. Does it shorten your life?
Uh-oh.
In a review of 6 large-scale studies that tracked more than 1.5 million people for periods ranging anywhere from 5.5 to 28 years, the researchers found that a diet that includes red meat raises the risk of developing cardiovascular disease and cancer, as well as health problems like diabetes and high blood pressure.
Their review was published under the title, Is Meat Killing Us?, in the Journal of the American Osteopathic Association. And joining us on the phone from Arizona is the lead author of the Mayo Clinic Review, primary care internal medicine specialist, Dr. Heather Fields. Welcome to the program, Dr. Fields.
Thank you so much.
Dr. Fields, good to have you on the program. I'm not sure we want to hear what you have to say, but go ahead and tell us about the red meat study.
Well, this was a clinical review of epidemiological studies. So these are very, very large-scale studies, like you said, over 1.5 million people. These are not clinical trials, so we can't prove any cause or effect with the studies that we reviewed, but we can only see correlation.
And what? Go ahead. Keep going.
But that being said, we do see more often than not correlation of increased risk for all-cause mortality and certain diseases with the dangers of red meat, especially processed meat.
And what did the data show when you looked at all of these different studies together? There's lots of different conclusions that were made or pulled out of there, right?
Yes, there's several conclusions because we looked at several systematic reviews. And so the problem with this is that there's quite a bit of heterogeneity, which means that the different systematic reviews were done in studying and looking at different primary outcomes. So sometimes cardiovascular mortality, sometimes cancer incidence. And moreover, even the studies within those systematic reviews that they looked at, the cohorts that they looked at also were quite heterogeneous. So it's hard to tease out and then try to compile this and perform a full review of it. But more often than not, we see association of red meat and processed meat with mortality and with cardiovascular disease, cancer incidence, those things.
So cohort means what group you looked at. But were this all based on surveys? Did you survey different groups of people and ask them how much red meat they ate? Is that how you did it?
So we didn't survey anyone. We simply reviewed the literature. So we used a librarian to look at these past studies. Now, the cohort studies did seem to usually, nearly 100% of the time they were using surveys for people. Sometimes they would survey them only once, like at the beginning of the study, and sometimes throughout the course of their study if they were to move forward over the course of several years.
Now, you indicated, I think, that there are some meats that are more harmful than others. You said particularly processed meats?
Yes, processed meats, which would include bacon, sausage, deli meats, hot dogs, ham, or any kind of meat that would undergo some processing, curing, fermentation, salting in particular.
The really good stuff.
The good stuff, the stuff everybody really likes.
Yeah.
So those ones we see a very strong correlation with mortality, and the World Health Organization even put out a statement in 2015 that they are not only probable or possible, but more of a definite cause for increased mortality, specifically with cancer and colon cancer, moreover than any of them. Now, the increased risk is a relative increased risk of 18%, which means it really increases your baseline risk for colon cancer from 5% to 6%. So we're talking small changes here for one individual, but over a population, it can make a big difference. And so I think that's why they wanted to highlight that and mention it.
Now, that's not much difference. Pass the bacon.
Oh,
Exactly.
Yeah.
Exactly. Hard to make some convincing statements there from that.
Well, it is, though. I mean, when you're talking about life expectancy and cancer, things like that, it does
Yeah.
it does gather people's attention up.
Yeah, it sure does. It sure does. And it kind of is a pick your poison, pick how much, and also kind of comparing certain, evil foods to other less evil foods rather than making a blank statement. I would say, as far as overall diet is concerned, any processed food is going to be bad. We just haven't simply studied other processed foods, whereas meat has been studied, for just several decades. So when you look at something like red meat that is unprocessed, you have to wonder, well, sure, maybe it does have this small increase in mortality, but if we compare it to other foods, say other processed foods, is it worse? I can't answer that.
Are you a believer? Have you reduced the amount of red meat in your diet?
Yes, to be honest, in my personal diet, I never had a specific craving for meat anyway, and I include not only the health effects but also the environmental effects, the ethical considerations, and just don't personally feel a need for red meat in my own diet. How I counsel patients usually depends on each patient's specific situation and trying to meet them where they're at. There are, other considerations to look for as far as health effects. So I don't always advocate for a 100% vegan diet, but I do advocate for a whole foods plant-based diet, and then tell patients, if they choose to include meat, to focus more on fish, those ones that contain, omega-3 fatty acids, long-chain omega-3 fatty acids.
Like salmon?
Like salmon, exactly. Wild Alaskan salmon is the best. But other kinds of meats, like red meat, I always tell them to choose grass-fed, pasture-raised, organic, without any hormones added.
And that tastes a lot better.
Does
It sure does. It does.
The fat content does change, but when you have a grass-fed meat, you have higher omega-3 fatty acids, and those are going to be better for you. So.
All right, so I guess it's hold the bacon and bring on the fish and the chicken. Chicken okay?
So far as our epidemiological review, white meat did not have any increase in any mortality that we could see. I would say, we don't see any problem with chicken based on our studies. You might see some on some other clinical trials, and again, it depends. If it's, truly cage-free chicken that's allowed to roam on the pastures and is fed an appropriate grass diet, then it's probably going to be better for you. Hormone-free, those sorts of things.
All right, but processed meat is what you really ought to try to avoid.
Processed meat, I would say, would be the number one thing to avoid, or at least cut down on, and maybe save it for a special treat.
All right, primary care internal medicine specialist Dr. Heather Fields joining us from the Mayo Clinic in Arizona. Thanks so much for the update. We'll cut back on the red meat.
Thank you, sir.
Thank you.